We begin the news in Abuja, where the Nigeria Center for Disease Control has confirmed 32 Delta variant cases of coronavirus. The new cases are reported in 5 states across the country, and that means that the dreaded Delta variant is finally here. The Director General of the NCDC, Dr. Chikwe, made this known during the resumed briefing of the Presidential Steering Committee in Abuja. 19 of the cases were reported in Akwa Ibom State. Mr. Hikwazu listed Lagos, Rivers and Oyo states as well as the Federal Capital Territory as the places where at least one case of the Delta variant of COVID-19 has been confirmed in the country. Helena Samede Akins reports.
Since the Delta variant of COVID-19 found its way into Nigeria on July 8th, it has continued to spread across the country. Months after the confirmation of the variant in Nigeria, cases of the virus are now on the rise again in the country. The variant has now made its way into Lagos, Akwa Ibom, Oyo, Rivers, FCT and Plateau states, and it accounts for the rising cases in these states and across the nation. Lagos alone accounts for about 50% of the cases. Nigeria is now recording an average of 500 cases daily in the last 7 days, and test positive ratio has increased to about 6%. The steering committee wants residents from affected states to avoid traveling for pleasure to help curtail the spread of the virus.
This development calls for great caution because the virus is very virulent, raging in so many other countries of the world. We must therefore keep observing the non-pharmaceutical interventions and also ensure that we get vaccinated when the vaccines are made available very soon.
As of this morning, 32 confirmed cases of the Delta variant in Nigeria, 32, right, from 5 states. Some of these have been in returning travelers, some have been local transmissions. Now, the biggest batch of sequencing that we got this morning was out of Akwa Ibom. So out of 23 cases there, 19 were the Delta variant.
The committee also released guidelines for diplomatic travelers as part of efforts to reduce the spread.
But for non-restricted countries, the diplomats coming from those countries just have to have that 72 hours prior PCR test, and then within 7 days do a test in any accredited private laboratory. Diplomats coming from any of those four restricted countries or have visited any of those 4 restricted countries within the last 14 days, there's a possibility of a waiver for them. But nevertheless, with that waiver, they would still need to be screened at the airport, before entering into the country.
The world has added about 4 million cases of the virus and under 100,000 deaths in the last 1 week. To avoid the impact of these variants as seen in other parts of the world, Nigerians must begin to take responsibility to protect themselves and their loved ones. Helena Samede Akins, TVC News, Abuja.